Hi there, it's Dr. Chuck from mybackloop.com. In this long but informative video, I'm going to cover the 2 quick and easy self-corrections for an elevated or high hip. Oftentimes a high hip causes a shoulder problem higher up or a foot and knee problem down below. We're going to talk about the high hip, and for this discussion, let's assume that the right hip is high. You have to fix or address or self-correct the high hip. Otherwise, you're walking around with compensations. If this hip is high, I'm going to have compensations higher up in my shoulders and then in my neck and my head. So you're going to the gym and you're working out with the weights, or you're going doing some activity and you're walking around with this, you're just driving this distortion into your body. So you want to level your hip because it's extremely important. Okay, we're going to start with one of the first basic corrections, and that's the high hip. Understand that a high hip, for the most part, is nothing more than a pelvic rotation or a pelvic torque. So we're going to demonstrate that, and then I'm going to show you the correction, and then we're going to show you the result of the correction. Stand up for me. So what you do is you come midline, put your hand middle of the hip, middle of the hip. And what you see in this case is we've got a high right hip, is what commonly I find in my office, but most people will have one side higher than the other. Okay, go face up on the table for me. So we got a real easy, what I call a self-correction. So if the right hip is the high hip, the right leg is the long leg. Therefore, the left hip is the low hip, and this is the short leg. So the correction is always to the low hip or the short leg side. So bend your knee, let your leg go sideways, straighten your leg. Bend, sideways, straighten your leg. Do that 10 times. So this is one method to improve that rotated pelvis or the high hip. There's a second method which I'm going to show you in a second. Again, the high hip is the side that typically rotates forward, so the hip has gone anterior. And the reason it's high is because of the shape of the hip. So when it rotates forward, the bone is a little bit elevated. So if this part of the hip rotates, that brings that up. And that's why that hip going forward is actually the high hip, and in this case, the long leg. Second correction for the same thing. We use blocks. You can use a pair of shoes. You can use your hands or your fists in the same position. So the low hip gets the high block. The high hip gets the low block. So you can lay like this for 10 minutes. You can impulse here and just put pressure. But essentially this method does the same thing as moving your leg to the side. I find moving the leg to the side, to the low hip side, is just faster. But this works really good, especially if you're in lots of pain. So we're going to get her to stand back up, and we're going to look at the hips to see if we've now got a corrected hip. Go ahead and stand up for me. Okay, so now we're going to come back to the hips. Again, midline, come down, midline, come down. And now we've got a level hip. That right hip is now self-corrected. So that's how you self-correct your hip. When we're talking again about the short leg and the long leg, commonly you're going to see a difference in the feet of about 1/2 inch to 3/4 of an inch. If there's only a slight difference in the leg length or the hip height, this next correction works really well. And what it does is it unlocks the sacrum. So this is just simple modification of a yoga move. Bring your knee to your chest. Kind of grab that knee, just gently pull, relax. Do the other one, same thing. Good. So do this 10 times on each side. Is a great additional move to the high hip correction. And basically it unlocks the sacrum, which allows that sacrum to move when you walk. So I like to, for the amount of times and the amount of time this takes, 10 times each leg's always alternating. It's quick, quick, quick. It's a great addition to the high hip move. Thanks for watching. We know these exercises will help you. We hope you will like us and comment on our videos as you send them to your friends. You deserve to feel good.